Okay, so welcome back to my channel. Today I am going to be talking about shoulder injuries. My friend Deanna here just went through a shoulder surgery and injury. So we're going to get into that in just a second. But if you guys can smash the like button, subscribe to the channel. I am going to be posting some more videos about my process of going through ACL surgery and shoulder AC joint separation surgery. But let's get into it.
Drove me insane.
Yeah, it's the worst thing ever.
It helps you, but it hurts.
Oh, I can't believe I'm seeing this thing again.
Disgusting.
So this thing, you have the little pouch, right?
Yeah.
So
this was in my neck. It's disgusting.
So this little pouch is just like hanging off like your sling, and then this
heavy.
Thing is just like
it's sort of like a ball sack, just there for 3 days. And then you have this like knob here. But this one. You have this knob, so she said you leave it up. It basically is like after the surgery they give you anesthesia, and then it lasts you like for the next day.
Yeah.
But she said to last you like 72 hours, we could give you the additional nerve block. And she said not everybody gets it. Like it's not, you don't need it, but it helps with the pain, the next day.
Yeah.
And for me, I have a high pain tolerance, but I was like, you know what? I don't want to. This is my first surgery.
This is a different kind of pain.
Yeah, I was like, this is my first surgery. It's not like I broke my arm. It's like I'm getting cut open. I don't know that pain.
Yeah.
Like in that mass, like
Dude,
of a size.
It's a different kind of
pain. So I was like, let me just be safe. And I didn't even know if my insurance covered it. I was like, you know what? Let me just like play it safe, whatever. Like it's, how often does this fucking happen?
Yeah.
I'd rather spend money on this than like a dinner or a trip, whatever.
Exactly.
To save me the pain. So this basically lasts you 3 days, and you keep it at like a notch, which is 10, and then if the pain goes up, you could put it to 12 for like 2 hours, and then you put it back down.
Exactly.
Yeah, but the thing is that this like catheter right here, which is the plastic, is in your neck, and that actually hurt me more.
It just feels like
hurt me more than the pain of the fucking like surgery. And I'm fine with needles, piercings wise, but when they're injected and like they just stay there, I can't.
It's weird.
Yeah, so I don't regret getting it because it was better to be safe. But the thing is, that's what caused me the most pain after recovering, was because the tape was so so stuck on you. I felt like you were getting like waxed almost, taking it off. It was like glued to you. And then that needle, taking off the needle, you barely felt it. But when it was in you and you're trying to sleep, like you feel like kind of the plastic like part bothering you.
Yeah.
So that's why I even called her the next day and I was like, hey, is it okay if I take it out? And they said it's fine. A lot of people will take it out early because it starts to bother them.
Yeah.
But I was like, man, I don't want to, I don't want to waste it. Like, I don't know if, because the anesthesia from the surgery was going to wear out. I was like, let me play it safe. There's this little bit more fluid left. And the thing is, I didn't know. So this first bag was filled, and then the inner bag was filled too. But then the first bag deflated, and I thought it was empty. So I was like, okay, should I just take it out? And they're like, no, wait for the inner ball thing to deflate too, which I didn't know. So, but they gave you directions. But just in case, like people are wondering, make sure the whole thing is like out before you take it out. And it's mainly the tape that's gonna hurt versus the
No, you're good. You're good. No, it's the blue color. Even when you sent me the picture of your arm, it's all blue.
Oh my God.
No, it was the same thing happened to me. Mine lasted forever.
And I did my nails like 3 days before. Like I had to, get the second surgeon.
Can you see the scar or no?
No, it hasn't.
Oh, it's still okay.
I'm like,
yeah,
flash
it's still
the camera.
There. I'm
gonna take it out on Friday.
Okay, cool. I'm excited to see it.
We're
gonna have matching scars.
I know.
We're gonna have matching scars. Excited. I'm down.
I feel like we're branded by Dr. Itamura.
Yeah, exactly.
Cult.
Yeah.
We should be in his cult or something.
No, that's crazy, man.
Yeah.
It's like it reminds me like it's no one will understand unless you've been through it.
Yeah.
And like you're still gonna go through it. You know what I mean? Like you just started.
Yeah, because before I like tore a rotary cuff, but it wasn't like I needed surgery. I just had to wait for it to heal. Like I went through physical therapy, and now I forget it even broke. So I use that same mentality, like, okay,
Sure, yeah.
like it, nothing's temporary. In
Yeah.
a year from now, or that quote that's like 6 months from now, you're not going to be in the same place. You won't even remember it.
Exactly, yeah.
Life
like my
is
shoulder
too
just
quick.
feels normal right now.
Yeah, it's like, I know I'm going to move past it, so let me just,
Good. And that's how it was for me with my shoulder.
Yeah.
Obviously, my knee is a whole different situation.
It was even intense.
Yeah, well, it was intense because I had just finished my shoulder and I just hurt my knee. So
Yeah,
that's a whole different story. But I think right
Yeah.
now is like you still have to go through your physical therapy and whatever. But apparently, so for me, it was like 6 to 9 months kind of deal.
Oh, man,
like,
that's...
right? Like any reconstruction kind of surgery. For you, it's different because it's just basically like a broken bone. So it's like 6 weeks or something, right?
Yeah, not too insane.
And then you just have to get your strength back a little bit. And
yeah,
then
like
that's pretty much
light
it.
working out,
and
even like stretching I think is great. Stretching is amazing. A lot of like how you said the ball.
Yeah, squeezing the ball. Totally, yeah.
Flexing, massaging. Like I think that's all important. But it does suck knowing in terms of weightlifting.
Yeah.
Like you get to a certain strength.
Yeah.
But it goes to show like nothing is temporary or nothing is permanent.
Oh yeah.
Like nobody's strength is, mental strength is always there, but your looks, your strength, it's not a temporary, not a permanent thing.
Yeah.
That you can't rely on anything. Like you can't rely on, having your arm, you can't rely on having your legs always being okay. You have to be like mentally put that in your head, like nothing is a permanent.
Yeah.
And you have to just make best of what you have.
Yeah, and it's hard.
Time.
Yeah, it's hard. You just gotta push through it.
And it could always be worse,
Yeah,
like,
of course.
I'm like, at least I don't have a cast.
Broken neck, whatever.
Exactly.
Like the way we fell, it's just it could have been worse. That's how I always thought about it. But it's good we both had helmets on.
Oh, you did too?
Yeah, I had a helmet. I always wear a helmet. Yeah.
Okay,
I don't mess around with that.
Yeah, you can't.
Yeah. But your sling right now, you're just wearing the emergency room sling.
Should I get the fancy one?
No.
Okay.
I don't even want to look at it, honestly.
What do you mean?
The big fancy one. I don't even want to see it.
I
tossed mine. I'm like, I never want to see this again.
I would see your lead sling for like months or like weeks.
Yeah.
I remember like every time I would see you in like that like cool sling.
Yeah, and literally I'm like this for 3 weeks, like walking around, and I'm just like, I'm sick of this thing.
You're like those guys at the gym that wear like those like slings on them to be cool though.
Oh,
but you needed it. It was different.
Yeah.
But it was kind of like those guys that kind of just like wear them.
So the last week of me wearing that sling was because Dr. Itamura told me he doesn't want people to bump into me or like, hey, what's up, man, and like hit me on the shoulder because it happened so many times after I took off the sling. Like you don't even understand. Guys like were jumping on me like, what's up, man? Like, I'm like, like I had to do it for months. I was like, yo, get away, like I have to protect myself.
Yeah.
Straight up, it sucked. But yeah, for me, I had to wear it longer than you. Like he told you could take it off now. For me, I couldn't. Like I had to literally go like this if I wanted.
And just hold it.
And my mom had to bathe me.
Yeah. Oh man, I had to go pee with my mom. Like
yeah.
It was only like 2 days though.
Yeah, no. But for me, it was a couple
wasn't
weeks.
As bad as you.
Yeah. I would literally go and sit in the bathtub, and my mom would. Oh.
Let me tell you, you go back to being a baby, but it's like let me enjoy it. Like before I move out and I don't see them.
Dude, yeah.
It's the last time.
God bless my mom. Like she helped me.
Yeah, moms are amazing.
Yeah, but
moms
it was
amazing.
It was 100%. Like it humbles you like to the max. It's like dude, I'm a grown ass man. Imagine like my mom's bathing.
Wiping my ass.
Like straight up. It sucks, dude.
Humbles you. Yeah.
Yeah, but no, I think you still have some time. Like you still have a journey to go through.
Oh yeah, it's not as bad as yours. I mean,
no, it's not even about that. It's different. Like it's all different.
It is like I think because the 2 weeks before this or the week and a half before this surgery, I got used to just chilling with the broken collarbone.
Exactly. Yeah.
That I was like, okay, like you just kind of get used to it, and then now it just like with the surgery, I'm more careful. Because I don't want to have to, God forbid, like something happen and it doesn't heal properly, then I have to go back and get it, fixed. But yeah, he said like you could keep it in the sling for the first 2 weeks for comfort, but then try to take it out like every couple hours, stretch it.
So I'm going to link Deanna's IG and all her social media and stuff down below. if you have any questions, me, her, are you okay with questions? If people hit
Oh
you up
yeah,
for questions?
totally.
Yeah, hit any one of us up. Like again, hit the like button, subscribe to the channel, comment down below if you have any questions as well. Answer as much as I can. Thanks so much for watching.